So in our final few moments here with our conversation with David Aronoff, who's the director of Infectious Diseases, Vanderbilt University Medical Center, I kind of want to ask what should we all take away from this? But also there are some who question how serious this even is, and is that a manifestation of how successful we have been in social distancing and doing Zoom calls like this and fewer people getting sick? I guess when you hear people question how serious this even is, what do you think?
Yeah, I mean, it's always very, very tough to be a healthcare worker who's involved in the care of hospitalized, very, very sick people who were people's brothers and sisters, moms and dads, grandparents who are dying of COVID-19. And their life is clearly being cut short by this virus. In Tennessee, we've had over 2,000 people who aren't with us because of COVID-19. And in the United States, over 200,000 people whose lives were clearly cut short by this infectious disease. But even though those numbers are great, they're small enough that maybe not everybody has known somebody who's died of this infection or seen somebody. You know, in Tennessee, about 4 to 5% of people who we know have COVID-19 get put in the hospital. Well, that means 95% of the people who are diagnosed with COVID-19 don't go to the hospital. And so that can really leave people with the impression that there aren't serious consequences of this, but that's part of our job. And one of the joys I get of communicating with people is to help people understand the gravity of this situation and to emphasize why it is so important that people who don't know someone who's been very sick with COVID-19 still help us slow the transmission of the SARS-CoV-2 virus. You know, we're actually seeing decreasing cases of COVID-19 in the United States and in Tennessee and in Davidson County, not because we have a vaccine, because we don't, not because we have effective treatments that we can use for people outside of the hospital, because we don't. It's because every individual who has chosen to be part of the chain of protection against infection has really been making a huge sacrifice and a huge difference. And it makes a difference when you keep your distance between others. It makes a difference when you choose to take food out instead of eating out. It makes a difference when you wear your cloth face covering in public and when you pay attention to hand hygiene. These simple, albeit they are sacrifices, but relatively simple public health measures absolutely are saving lives, and the data are very clear to that extent. So it is always a problem of out of sight, out of mind. If someone hasn't seen or known somebody very sick with COVID-19, it may not exist. But I'm here to help tell you that unfortunately it really does exist. And unfortunately, we're seeing people get sick and dying from this infectious disease, and I'm very thankful for people who are helping to prevent it.
Well, thank you. Thank you for coming on and answering our questions. We will take a break, come back, wrap everything up right after this.